Hello everyone, my name is Sharon Veron Akisa, a telemedicine medical officer. I'm here to talk about cough and flu, which is currently very rampant in Kampala and all over Uganda among the school-going children. So cough is a reflex action that simply clears our respiratory tract of excessive secretions. The respiratory tract is basically the branching system in our lungs that helps transport oxygen or air in and out of the system. So cough is caused by very many things. The very first one are infections, things like bacteria, viruses, touching dirty surfaces, and eventually you touch your face, your mouth, and eventually you get the virus. Then next, it could also be allergies. It could also be conditions like asthma, sinusitis. All those could really cause a cough that eventually would also come in with a flu. There are characteristic types of cough. There is the whooping cough, which is most likely a barking type of cough when the child coughs like they are barking. Then the next is the dry cough, which most times comes in with the flus. Then the other one would be the hacking cough, which will most times come in with the colds that the children present with. So it's very important that we, the caretakers or the mothers of the children, notice exactly what type of cough our child presents, as this will help with the management of the cough. In the treatment of coughs, there are basic home remedies that our mothers and caregivers can use to give their children. One, they can breastfeed the babies, mostly those who are less than 6 months. They have to continue exclusively breastfeeding them. Then also those who are greater than 6 months, they could give hydration, like warm fluids specifically are really good because they help thin the secretions, which will eventually be expelled. Homemade mixtures could also be used, but this is all very useful in children who are greater than 1 year. Mixtures like lemon, garlic, ginger with honey to soothe the throat. These will extensively boost also the child's immunity, coupled up with you adding fruits and vegetables. These also would help. When some of these home remedies are failed, then we may need the medications, and depending on how the child presents, the appropriate medication will be offered. Syrups would be given to help with a cough syrups which would suppress the cough centers, and others that would break down the mucus so that it's eventually expelled from the system, are also very useful. So depending on the child's presentation, the doctor would administer these medications. But just to note, it's very important that the parents boost the children's immunity, because the children will keep on coming in with different bouts of cough and flu. So in the children at school, there are different measures that the teachers and school authorities can use to combat the spread of cough and flu. One, they may need to disinfect the different surfaces that all these children are frequently touching. Two, washing hands, which is very important, and if possible they could also schedule specific times of the day that they have to wash their hands. Three, they may need to advise the children to avoid sharing personal items, which could be rubbers, instruments, depending. Four, they may need to encourage the children to always sneeze or cough in a tissue, or maybe using the fold of their arms to try and reduce the spread of cough and flu. In case the symptoms persist, please do not hesitate to reach out to us by dialing *280# to speak direct to our doctors. I still remain Sharon Veron Akisa, a medical doctor with Rocket Health. Stay safe.